Hello, my name is Amos Mansfield. I'm the president of the Georgia Athletic Trainers Association. Thank you for attending this video presentation on medical timeouts. The objective of this video is to discuss what is a medical timeout, why it's important, the medical checklist, and to demonstrate a running medical timeout. The medical timeout is a meeting of available personnel for any aspect of emergency response at a predetermined time, but prior to the start of athletic play. During this meeting, a preparedness checklist will be covered with concentration on head and neck injuries, including concussion, athlete collapse, cheerleading and band, and spectator injury response. Contact numbers will be verified, hand signals will be determined, the delineation of responsibilities in any various situations, determination of emergency equipment available and location, and troubleshooting any special circumstances that may exist. The medical timeout will prepare you to respond to any medical emergency, and we like to use the acronym COPE. Communication. A communication plan is developed before a potential catastrophic event rather than when that event occurs. Who's calling 911? Who's removing equipment? Holding C-spine? Where's the AED? How do you call for EMS to come to the victim? Who calls the event in case of a threatening weather or lightning in the area? Organization. Tasks are identified and assigned before they are needed rather than when they are needed. What is the role of the officials, the on-site administrators, coaches, athletic director, visiting teams and medical staff, and their coaches? Preparation. You would like to troubleshoot prior to the event to discuss any kind of roadblocks that may prevent you from delaying care to your athlete or to your venue or exiting the venue. Execution. Rehearsal of your emergency action plan is vital for the medical timeout. This is a learned response rather than an instinct. Now let's talk about why the MTO is important. The importance of a pre-procedural or pre-event timeout has been demonstrated in many parts of our society. Whenever we board an airplane, before we take off, the flight crew communicates the emergency plan for the specific plane. Hopefully the pilot has done the pre-flight checklist. Before surgery, the OR team does a timeout. It keeps your emergency response plan current and event specific. It protects the medical well-being of our student athletes and spectators during emergency situations. It coordinates the response team's tasks to maximize time delivering care and eliminates chaos and confusion and focuses efforts on high-stress situations. It provides a non-confrontational approach to merging multiple medical and allied health professionals into one strong response team. The medical timeout shows foresight and preparation on the part of the emergency response team. Bad outcomes may happen, but the 5 Ps will give the best chance for positive outcome. 5 Ps are: proper preparation prevents poor performance. And remember, someone is always watching and recording your response. Your MTO pregame checklist is a medical legal document if recorded and maintained. A properly conducted MTO with documentation is the best first step in defense against medical legal claims. Combined with a well-planned and rehearsed emergency action plan, this shows preparation and attentiveness to emergency planning. The checklist front side awareness points. EMS, Advanced Cardiac Life Support. Make sure there is one present and they are out of the truck and near the field of play. AED, where is your AED? Is there on both sidelines or EMS only? Sentinel seizure awareness. Agonal respiration awareness. Spine board, where is your spine board? With many EMS squads adopting no spine board policies, is there one at your venue? Face mask tools. Where are they, and are they adequate for all types of helmets in play? Multi-tool approach. Just because the helmets look alike, clips may be very different. Equipment removal discussion. Who is present with knowledge of equipment and safe removal if there is need to remove before transport? Establish who is present and verify phone numbers. You want to have EMS contact information and backup numbers in case one has to transport and minimize gap in coverage. You also need to designate a hospital for transport, and you need to have contact information to the emergency department to be able to communicate with the accepting trauma team. Be sure your game day administrators are involved. They need to have knowledge of your emergency action plan so they can help with assistance and implementation. Important things to note are keys to gates and locked door access. Are physicians available? Are they on the home sideline or just the visiting sideline? Who is present? Home and visiting team athletic trainers. Establish communication to be able to communicate care with equipment needs. You need to also have contact numbers for your police department, campus security, and your fire department. The checklist for injury and illness response. You also need to have hand signal designation. Checklist has suggestions, but you may already be established with your own protocols. Examples are a forearm cross to make an X, ACLS and AED to the field, a baseball safe sign, spine board to the field with ancillary supplies, finger pointing to the head, concussion. You also need to identify who's responsible for attending to cheerleading, band, and spectators. Who is responsible? Where is the athletic training? Where is the medical staff? Are they in the locker room with the football team? You also need to identify Aero Medical Landing Site, location and landing coordinates. And you also need to get with police and fire department to assist for traffic flow. Now let's talk about running successful timeout. We're going to do a sample medical timeout and run you through the procedures. Now remember, the medical timeout is only as good as your EAP, so you need to practice your EAPs and make sure that they're venue specific. By coordinating a venue specific EAP, every scenario for your medical timeout would be different, depending on your venue, depending on what personnel is there. This is a way to take your EAP and make it a living document. Okay, here we are at Marietta High School. We're doing our medical timeout. We've got our personnel in place. We have our EMS crew, we have our sports medicine staff, our athletic trainers, we have our sport administrator, we have our campus police, and we have our referee. Okay, we're going to go over real quick kind of our protocols of what we do for the medical timeout. This is basically our emergency action plan. Okay, we have our contact information for all people involved, cell phones, landlines, and radio communication. Okay, we also have our emergency equipment. Our paramedic crew has our advanced life support equipment. Our sports medicine athletic training staff has their sideline equipment, including AEDs, as well as spine boards, as well as splint kits and the necessary needs that we have. Okay, in the event that we have to transport someone and we need EMS on the field of play, our athletic trainers will give our signals to you all to coordinate what is needed on the field of play. That's going to be venue specific. We want to use that as, depending on what school you're at, where you use, how you communicate, you need to identify it during this meeting. We do have potential weather in the area. We do have a weather system that alerts us when tornadic or bad environmental weather conditions are in place. Our sport administrator will be notified and he will let the official know if there's a problem where we have to suspend play. We will have the ambulance crew for the field of play. We will also have another ambulance crew for our stands, which will include cheerleader, fan response, band that can help them as well. In the event that we have to transport to the hospital, we will go to Children's Healthcare of Atlanta, and our sports administrator will follow the ambulance and when they leave to make sure that everything's taken care of when we get to the hospital. A current and venue-specific EAP is a critical piece in the planning of, protecting, and treating the participants you care for. Remember, you may be caring for the entire community of visitors, staff, coaches, officials, and your athletes. Included in your EAP, you should have a list of your risky athletes. Do you have ones with diabetic? What is the target glucose range? Where is their insulin? Do they have an insulin pump? Do you know how to reinsert it if it becomes dislodged? Who are your sickle cell athletes? What elevation are you playing? Asthma athletes, where are their inhalers? Any athletes with allergies, where is their EpiPen? Do you have an EpiPen for an allergic reaction in the undiagnosed athlete? Has it expired? You are now ready and able to run your own medical timeout. Remember, preparation and training is the key to successful venue-specific emergency action plans. You need to identify who needs to be at your medical timeout, establish what resources you have readily available, and what resources you may need to call for. Establish clear lines of communication and have means of backup communication. You also want to establish who will be in charge, assign the task with the understanding that the situation will become fluid and change. For additional resources, please visit our website. This educational video was provided to you with a grant from the Southeastern Athletic Trainers Association. I would like to thank the Georgia Athletic Trainers Association, the Cal Group, Children's Healthcare of Atlanta, the Georgia Nurses Association, Metro EMS, Marietta City Schools for their sponsorship and help in the production of this educational video.